My name is Tiina Väre, and I work at the University of Oulu as an Academy of Finland funded postdoctoral researcher. The main objective of my research is to look at the breastfeeding and weaning practices of past populations using stable isotope analysis and skeletal human remains. I have been oriented towards the effect of breastfeeding on somatic health. After all, the link between psychological or social well-being and breastfeeding is difficult to study using my materials.
Damages to the psychological health or in social interactions are not as readily observable in physical human remains. Signs of certain types of interpersonal or self-directed violence excluded. However, the social and possibly even psychological effects of breastfeeding or the lack thereof in the past are another relevant aspect concerning the topic. Could it be that our current experiences are rooted in events centuries ago? This makes me think, could locating them help us move forward into future less bound to possible damages in our ability to form secure attachments and lead happy lives? One cannot help but to think whether it is possible to reach to the minds of our ancestors in this way. To attempt, I will have to believe that the current theories are universal enough to be applicable to people who lived during different times. Breastfeeding is held in high regard as foundation of lifelong somatic but also psychological well-being. A long breastfeeding period is considered ideal, although it is understood that breast milk alone will not satisfy the nutritional requirements of an infant over 6 months of age. Supplementary breastfeeding should still be continued at least until the end of the 2nd year. Weaning, which means the gradual introduction of new foods into the diet of the suckling, always poses a risk, as instead of sterile mother's milk, the infant's body is introduced to a completely new set of microbes. Yet to ensure that the nutritional needs are properly met, after the period of 6 months of exclusive breastfeeding, selection of suitable weaning foods and hygienic practices related to serving them is essential. Being nursed may have a comprehensive effect on long-term health and thus the entire lifespan of an individual. Evidence for the role of breastfeeding in providing protection against infectious diseases is substantial. It profoundly affects the formation of the infant's immune system. Even cognitive abilities, educational success, and higher intelligence in adulthood have been linked to longer periods of being nursed. In contrast, absence of breastfeeding has been suggested to impact the development of conditions such as allergies, autoimmune diseases, or inflammatory bowel disease, and even certain neoplastic conditions. Breastfeeding benefits the mother's health as well. Initiation of nursing helps the uterus to contract postpartum. The added energy demand caused by lactation helps losing the pregnancy weight. This probably contributes to the preventive effect breastfeeding seems to have in development of metabolic syndrome or type 2 diabetes and cardiovascular diseases. Breastfeeding may even reduce the risk of certain cancers by restricting exposure to certain hormones linked to their development. Breastfeeding may even reduce the risk of certain cancers by restricting exposure to certain hormones linked to their development. Beneficial psychological effects include lower levels of stress hormones. Higher levels of oxytocin and prolactin, important in lactation, are linked to both reduced anxiety and lower levels of cortisol. Overall, breastfeeding is believed to be an important regulatory factor of maternal stress and psychological coping after giving birth. It influences the oxytocin-mediated maternal bonding during early infancy and promotes interaction between the infant and the mother, who typically also takes the role of the primary caregiver.